The General Hospital. The main objectives of this hospital is to provide medical care. They care for patients with various disease conditions for both sexes to all ages, medical, surgical, obstetrics, eye and ear, and others. They also offer teaching and research facilities, but these are secondary objectives. So, general hospitals are meant to provide a wide variety of various types of healthcare, but with limited capacity. For example, the Davao Sanitarium Hospital, also located in Talomo, Davao City. The Southern Philippines Medical Center, it's along Bahada Road. And the Philippine General Hospital, which is located in Manila. Special hospitals. These hospitals concentrate on a particular body or a particular disease. So they limit their service to a particular condition, orthopedics, maternity, pediatrics, geriatrics, oncology, or others. So the main objective is to provide specialized medical services. For example, the Tibo Cure Hospital. It is located in Bahada Road also. It provides pediatric, orthopedic, surgical care, and it helps children with treatable conditions like clubfoot and spinal deformities. So the official grand opening took place in 2015. The Philippine Heart Center is located in Quezon City. It specializes in the treatment of heart ailments and it was established in 1975. Another example is the National Kidney and Transplant Institute, which is also located in Quezon City. Next, according to bed capacity. So a hospital which consists of 100 beds is considered small. So examples are MediQuest Hospital in Surreal. It has 46 beds. And the Medical Mission Group Hospital along Magsaysay, Davao City, with 80 beds. The medium-sized hospitals or they have more than 100 to 300 beds. Examples are San Pedro Hospital with 295 beds, Davao Doctors Hospital with 250 beds, Brokenshire Hospital in Madapo Hills with 200 beds, and Davao Medical School Foundation Hospital in Bahada Road, also with 100 beds. Large hospital, it has more than 300 beds. Examples are Makati Medical Center. Well, it's located in Makati. It has 600 beds. The St. Luke's Medical Center in Quezon City with 650 beds. The Southern Philippines Medical Center with 1,450 beds as of 2019. And the Philippine General Hospital, which is located in Manila, with 1,500 beds. Next, according to ownership, the government hospital. So the government or public hospitals are owned or managed and controlled by the government and receives government funding. This type of hospital provides free medical care and services to the community. For example, the Davao Regional Hospital in Tagum City, the Philippine General Hospital, and the Southern Philippines Medical Center. The semi-government hospital. The semi-government hospitals are an autonomous body. They are usually government-owned and at the same time controlled corporate hospitals. For example, the Philippine Heart Center and also the National Kidney and Transplant Institute. It is also a government-owned and controlled corporate medical center. Voluntary agencies hospitals. So they are owned and managed by voluntary organizations such as the Medical Mission Group Hospitals and Health Services located in Bohol, and we also have a Medical Mission Group Hospital in Davao City. It's along Magsaysay Avenue. Private hospitals. Private hospitals are hospitals that are owned and managed by private individuals or corporations like Davao Doctors Hospital or San Pedro Hospital, the Brokenshire Hospital. They're called or they're categorized as private hospitals according to the level of care. In the Philippines, hospitals fall under three different levels as set out by the Department of Health guidelines. So they classify it according to the level of care. So these are level 1. Level 1 is the most basic. Hospitals under this bracket don't require intensive care units and cater to patients who need minor care and monitoring. Examples are the Davao MediQuest Hospital, the Holy Spirit Community Hospital in Mintal, Davao City, the Davao del Norte Hospital in Capalong, and Somoso General Hospital in Panabo. Those are among or several examples of the level 1 hospitals. Level 2. A level 2 hospital contains all the elements of level 1, and it has additional facilities like ICU for critically ill patients and specialist doctors for other medical services. Examples are the Davao Sanitarium Hospital, the United Doctors Hospital of Tagum, the Medical Mission Group, and Tagum Doctors. So those are some examples of the level 2 hospitals. Level 3 hospitals. So a level 3 hospital contains all the elements of level 2 with the addition of specialty interventions like physical rehabilitation or dialysis treatment. It also offers to teach or teaching with an accredited residency training program for physicians like pediatrics, surgery, gynecology, and others. Examples are Davao Doctors Hospital, San Pedro Hospital, Brokenshire Hospital, and Southern Philippines Medical Center, as well as St. Luke's Hospital and Makati Medical Center and Philippine General Hospital. So those are examples of level 3 hospitals. Hospital services. The main product of the hospital is the medical services. Services may differ from one hospital to another. The following are the services rendered by a typical hospital. First, emergency services. This type of services needs attention on a priority basis. The emergency department is specially meant for patients having a sickness of a grave, acute, or chronic nature requiring immediate treatment. And it also serves injured patients brought by accidents or falls. Outpatient services. It is also known as Outpatient Department or OPD. OPD is a part of the hospital with allotted physical facilities and medical and other staff with regularly scheduled hours to provide care for patients who are not registered as inpatients. So these patients receive treatment or diagnosis, but they do not stay overnight. Inpatient services. After the patient is examined in the OPD or ER, they have advised admission in the inpatient ward for monitoring or treatment or necessary. So the patient is required to decide on his admission. The charges are different for private and general wards, and the government usually does not provide private wards, but nowadays the government hospitals or some government hospitals have already paid wards. Intensive care unit or ICU. The intensive care unit of a hospital is usually where the patients that are critically ill are admitted. This is also meant for patients who require special treatment. So these are, or there are machines to monitor health and blood pressure, heart rate, and ventilators to assist the patient in breathing and other life-saving purposes. The operation theaters. An operating theater is a facility within a hospital with surgical operations that are carried out in an aseptic environment. So one of the important facilities that every operating theater needs are the integration with the blood bank. Supportive services. Sterilization, supply, and maintenance of instruments, materials, and garments are some of the supportive services that assist the hospital services. So other supportive services are hospital medication, official laundry, laboratories, clinical pathology, blood bank, and the radiology department. And the nutrition and dietetics department are also incorporated in the supportive services. So they supply healthy meals in the hospital. The pharmaceutical services are also important and they influence the treatment program of hospitals. And lastly, auxiliary services. The auxiliary services consist of registration and indoor case records, stores management, transportation management, mortuary arrangement, dietary services, and engineering, maintenance, and security. So the hospitals play a big role in the promotion of health, prevention, and treatment of diseases. These roles make the hospital industry unique from other industries, such as business, education, commerce, and others. Health improving activities include exercise, proper nutrition, and lifestyle changes. So access to comprehensive quality healthcare services is important for promoting and maintaining health, preventing and managing diseases, reducing unnecessary disability, premature death, and achieving health equity for the community. So this ends our topic for today, and stay tuned for more updates. And thank you.